my name is Sarah Regan. I'm a nurse practitioner student at Maryville University, and I am here to do my head-to-toe assessment. I have a 31-year-old male patient named Brett that has volunteered to participate in this exam. So I'm going to go ahead and get started. Prior to the exam, I had him empty his bladder and I had him put on a gown, just so we can make sure that we can see everything on the body and do a good full assessment. I also did a set of vitals. We also assessed his vision. We assessed his nearsighted vision with the Rosenbaum chart, and then we did the Snellen chart for the distance, and everything was normal. So I'm gonna go ahead and start just examining his head. We're gonna go from head to toe. You don't have any problems right now? No complaints? No. Okay. So I'm just going to look at his hair. It all looks equal, thick. No, I don't see any lesions, no bumps or areas that hair's missing. All looks good. Your face, skin, everything is symmetrical, even. I don't see any abnormal moles or anything of that nature. I'm going to go ahead and palpate your scalp. Let me know if you have any pain.
No.
Okay. And then while I'm here, I'm also going to palpate your lymph nodes. I'm going to do the periarticular lymph nodes and then the post-articular lymph nodes. I'm also going to palpate your ears, make sure there's no lesions or bumps or no drainage coming from your ears. And then if you'll just look at me. So I'm just going to go ahead and take a look at your eyes. Eyebrows are normal. Hair growth is symmetrical. Thick eyebrows. His eyes are also symmetrical. His eyelashes go outward, which is normal. I don't see any lesions or any areas, bumps, or anything within the eyelids themselves. I'm going to palpate your lacrymus gland. Any pain here?
No.
Okay, and then I'm going to just do your sinuses. Any pain there?
No.
Good. So I'm going to stethoscope off. I'm also going to look at your nose. I'm going to just look and see if I see any places that I would think that you had broken your nose, which doesn't look like that. Symmetrical. I'm going to go ahead and take a look in your nose. Your septum looks good. Your membranes are pink and moist. Your hair is symmetrical. So that looks all good. We're going to test to see if the patency of your nostrils. So I'm going to just push, you'll just breathe in and out. Any pain?
No.
It sounds normal, good airflow in and out. I'm going to go ahead and take a look at your lips, your mouth. Lips are pink and moist and lush. I don't see any cracks or lesions or anything to be concerned about. I'm going to look inside your mouth.
Okay.
Looking for, making sure there's no dry, cracked mucous membranes. Your tongue is moist. Looking for any cracked teeth or any cavities that would be prominent. Also going to look at your uvula and your tonsil. Do you have tonsils?
Nope.
Okay, so I won't look at your tonsils, but I would on normal patients. Look at your palates. Make sure that they're moist and pink. You'll open up. Hard palate looks good. If you lift your tongue, it's all moist. Your floor of your mouth is moist. If you'll put your tongue to your right side and to your left side, and then just stick it out and say ah. Looks good. And then if you'll just smile for me. Your teeth are all intact and look good. Let's just test your gag reflex. Sorry about that.
That's okay.
And then I'm also going to test some cranial nerves while I'm here. If you could just blow out your cheeks for me. Can you smile? Can you wrinkle your forehead? Can you close your eyes and open them? All that looks good. Don't see any areas of concern. I'm also going to test to see your sensation, make sure all your senses are intact. So if you tell me you can feel this.
Yep. 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 Yep.
Okay, good. All your senses are intact. I don't see any areas of concern with your head. I'm going to go ahead and take a look at your ears. Have you had any hearing problems?
No.
Let's take a look at your inner ear, looking at your tympanic membrane. It's gray and pearly, so I don't see any drainage or anything. Looks normal. And your outer ear, like I said earlier, was looking good. Take a look at this one. Again, that looks all gray and normal and pink or gray and normal, I'm sorry. And I didn't see any drainage or any lesions on your ears. So let's test your hearing. So I'm going to do a whisper test. I'm just going to say a word and you just repeat it for me.
Green.
We'll come on this side and test it.
Yellow.
Good. I'm also going to test your vision just to make sure that all of your nerves in your eyes are working properly. So I'm just you'll just follow my little cotton swab here. We're going to test your cardinal signs of gaze. Okay, all of those look good. I didn't see any astigmatis or any rapid movement of your eyes.
Okay.
If I would have seen that, then I would have been concerned about something, but all looked good. Let's also, what else can we do with your, I think I'm good with all of your head, eyes, ears, throat looked good. Okay, so now I'm just going to go ahead and palpate your lymph nodes. So I'm going to start here. I already did the ones in front of your ears and behind your ears, but I'm also going to do the occipital. And then the submandibular. And the submental. And then the cervical. Deep cervical. Post-cervical. And then the supraclavicular. Sorry. And I didn't feel anything, no abnormal lymph nodes. I'm also going to feel your trachea, make sure it's midline. If you'll just look up a little bit for me, thank you. Trachea feels midline. I'm going to also check your thyroid, if you'll swallow for me. Don't feel any lumps or bumps or anything to be concerned in that area as well. Any problems with swallowing?
Nope.
Okay. Gonna go ahead and I'm just gonna take a look at your arms. We'll just move on down. So arm hair looks normal, skin tone is normal, it's pink, the skin is warm. Let's look at your brachial pulses. And your radial pulses are all good. Let's also do your carotid. Oh, looks good. Let's look at your fingers. I don't see any clubbing or cyanosis. Cap refill is less than 3 seconds, so that is good. Let's test your reflexes on your arms while I'm here. We'll do your brachial and your radial. Okay, that all looks good. What else can we do on? Let's test your strength of your arms. So just try to resist me and lift up and then down. That all looks good. How about your shoulders? Lift up. Okay, looks good. So I'm going to go ahead and listen to you, and we'll take a look at your back and make sure that everything looks good. So if you'll just bend forward for me. Just going to take a look at your cervical and lumbar spine, make sure there's no scoliosis. I don't see any reason for any curvature. I don't see any, you don't have a history of scoliosis or anything. Okay.
No.
Good. Okay, you can sit back up for me. I'm going to go ahead and percuss. I obviously would look at your skin on your back, make sure you have no moles, no lesions, no areas, masses, or anything of that nature. I'm going to go ahead and percuss. I should hear resonance. So if I were to hear something like dullness or anything like that, it's either an organ or a sign that there's a mass somewhere. So I'm going to go ahead and percuss. I'm also going to check your kidneys and make sure that there's no pain when I'm just doing this. Okay, let me know if there is. Any pain with that?
No.
Okay. While we're here, I'm going to go ahead and listen to you as well. Listen to your posterior lungs. We'll take a nice deep breath. Good. All your lungs sound clear. If I were to hear some abnormal breath sounds like wheezes or something of that nature, then there would be some indication that you had some fluid or something in your lungs. But everything looks good. I'm also going to have you take a deep breath in. Just looking to make sure that your diaphragmatic excursion is the same. On both sides, just to make sure that your breathing is symmetrical, which that all looked good. I'm going to go ahead and listen to your front. I'll start with the lung sounds and then I'll move on to your heart as well. So I'm going to go ahead and listen to your lungs. Now listen to your aorta, pulmonic, Erb's point, tricuspid, the mitral valve. Now listen to those with the bell of my stethoscope as well. I'm also going to listen to your carotid arteries and your thyroid just to make sure that I don't hear any. For your heart, I did not hear any gallops or murmurs or anything of that nature. But I'm just going to make sure that I don't hear any bruits or thrills or anything in your carotid arteries here, okay? Listening with my bell. Thyroid. sounded good to me. I also want to check for tactile fremitus. I forgot to do it posteriorly, so we'll start with that. So when I place my hands on your back, I just would like for you to say 99, just checking to make sure that I can feel the vibrations symmetrically.
99, 99, 99, 99.
Okay, and then we'll do the front.
99, 99, 99, 99.
Okay, so that all looked good. I didn't feel any abnormal. They were both symmetrical. No, nothing on one side or the other. All looked good. So now I'm going to have you go ahead and lay down, and I'm going to look at your abdomen. Is that comfortable for you?
Yep.
Oh, okay. And then lift your shirt up here. I'm going to look at your skin. I don't see any moles or any freckles that I would be concerned about. Your skin looks good, symmetrical. I'm also going to take a look here and look and see if I see any thrills or any heaves, which I do not see. Also, just looking for any signs that I would see, like a tumor or a mass or anything abnormal in that area, and I do not see that. So I'm going to go ahead and start with listening. So I'm going to listen to your bowel sounds, and then I'll listen to your arteries in your stomach, and then we'll move on from there.
Okay.
I'm going to start in your left lower quadrant. So I did hear gurgles in all four quadrants, so that means your bowels are moving appropriately. If they were not, if I didn't hear anything if I listened for 2 minutes to start, didn't hear anything, I would listen for 5 minutes, just to make sure that we don't have any bowel obstructions or anything of that nature. So I'm going to go ahead and listen to your aorta, and then I'll listen to your renal, iliac, and femoral pulses. Your renal, your iliac, and your femoral. All sounds good. I didn't hear any thrills or worries or anything of that nature, so that all looks good in that aspect. I'm going to go ahead and do some percussion, just listening over the areas that would normally have air in them. I will hear the resonance, and then if I were to go over any organs or anything that I would think there's a mass or something, it would be dullness. So I'm going to go ahead and do that. The only area that I did hear some dullness was up in this right quadrant and the left quadrant, which your right quadrant is your liver and the left quadrant is your spleen. So I'm going to go ahead and measure your liver. So it's about 6 to 8 centimeters. Normal is about 6 to 12, so that is good. I'm going to go ahead and do your spleen. That all sounded good. Going to go ahead and palpate. Let me know if you have any pain with this. I'll do some light palpation first. Any pain?
No.
Okay, then I'll do some deeper palpation. See if I can palpate the liver. I should not be able to palpate the spleen, which I cannot. Any pain?
Well.
Okay, so that all looks good. I'm gonna go ahead and I'll have you sit up, and I can see that you're able to use your ab muscles, so you have a good, strong core. If you were not able to sit up on your own or with a little assistance, then there would be some areas of concern there. I'm also going to percuss your chest because I don't believe that I did that, just making sure that there's resonance in that area as well. Which that all sounded good. So let's go ahead and we'll go ahead and move down. Look at your legs. His hair is all normal. It's symmetrical on both sides. I don't see any growth or any wounds or any abnormalities. I'm going to go ahead and feel your popliteal pulses. And your post-tibial pulses. And then your pedial pulses. And those all look good. I don't see any clubbing. No, your toenails are clean and not cracked. I don't see any fungus, and your cap refill is less than 3 seconds, so I don't see any areas of concern with that. I'm going to go ahead and do your knee reflexes. And do your Achilles reflexes. And that all looks good. I'm just going to test your strength, so if you'll just push up against my hands and pull down. Good. And then with your feet, push down and pull up. Okay. That all looks good. Any pain with that?
No.
Okay. What else did I want to do for this assessment? I don't think that there's anything else. So that will conclude this head-to-toe assessment. I appreciate you taking your time to be my volunteer. And that's it. Thank you. I'll have to cut this out because I can't.
Just have to enter your password.
It's unlocking.